Welcome back. President Cyril Ramaphosa has appealed to people to continue adhering to non-pharmaceutical interventions in the fight against COVID-19. The president last night moved the country from lockdown level 3 to level 1, but he echoed warnings from the health experts the country could soon face a third wave of COVID-19 as the winter months approach. Ramaphosa says eased lockdown regulations should not be viewed as a reason to abandon precautions and non-pharmaceutical methods of prevention. To talk to us more about this, we have Professor Nombulelo Magula, who is the head of the Department of Internal Medicine at the University of KwaZulu-Natal. Professor Magula, thank you so much for making the time.
Thank you for having me, Desiree. Good morning.
As health professionals, how do you view this move by the president to take the country to lockdown level 1?
So there are pros and cons to lockdowns. The benefits of slowing down infection rates at community level are the main benefits of lockdown. And at the beginning of the pandemic, the primary benefit was to prepare the healthcare system for the impending onslaught. In the meantime, basic science research to find a vaccine that works was underway, and there was also in parallel extensive global clinical research to find therapeutic options to treat COVID-19. So at the current time, we're very far from achieving the goal of vaccinating 67% of the entire population so that we can achieve herd immunity. So we are really concerned and cannot overemphasize the importance of staying vigilant and not getting complacent now that the lockdown levels have changed. The risk is still out there. It's very high.
We started getting reports of a seeming complacency way before the president announced the move to lockdown level 1. What can we say to South Africans at this moment about being vigilant?
All right. So what I can say to South Africans, both the community as well as healthcare workers, is that at community level, we need to remain vigilant. We need to adhere to the behavioral practices of keeping ourselves safe, wearing masks, washing hands, keeping a distance, not getting into social gatherings that are likely to increase the spread of infection. When we enter taxis, let's sanitize our hands and as we leave the taxis. Let's ensure that the windows in the taxis that we are traveling in are open. Everyone in the taxi is wearing a mask, including the taxi driver, the taxi conductor. So as citizens of the country, let us all take the responsibility of making sure that we stop the spread of infection and that we stand up wherever we are in the malls, any space that we're in, to make sure that we're taking responsibility to speak out and make sure that South Africans are protected. In terms of the healthcare workers, I urge healthcare workers to use this time to go out there and intensify contact tracing so that we find those people that are in the community and infected. Let's intensify our clinical skills to make sure that we can optimally treat those that have infection, and that we educate our public about what to look for, what symptoms to look for, and how to respond, not to stigmatize people, and the importance of quarantine, isolation, early access to care, and also the importance, just emphasizing the importance of knowing what this disease is and how it manifests.
Of course, we're heading for winter, and it has been said scientifically that this virus thrives more under cold environments. What can we do in preparation for this change in season?
So, apart from the climate change, the main trigger of the surges that we get, it remains the movement of people. So we have to emphasize, firstly, ensuring that we move only when it is necessary. Even moving across provinces, we just still need to make sure that we move when it is necessary. The problem with winter is the behavior that we adopt because it's cold. We get into our homes and we close windows. In taxis, when it's cold, you want to make sure that the windows are closed. So it's more about the behavior, really, that winter increases the risk. It's the huddling together, and thus, if there's anybody that is infected, that the infection increases. Also, the winter season is the time where we get a seasonal influenza infection. So it then becomes difficult to separate whether one has infection from COVID-19 or from your seasonal influenza. It makes it complicated to separate, even from a clinical perspective, for those that are treating patients, and thus the risk of missing patients that have COVID-19. So it then becomes very important to make sure that we are protected, in the same way, this current month, the month of March, is actually TB Awareness Month. So just knowing about TB and how we should be preventing tuberculosis will also protect us from COVID-19.
Just a quick one to end our conversation, and I know it's not necessarily your area, but it's from your institution, where the first South African solution for COVID-19 could be coming out from, in terms of finding a virus. Are you able to update us on this conversation, how far it is and what is being done at the moment?
Oh, Desiree, that's a difficult one, because that is more basic science research. My strength is really in the management of patients clinically, totally, as well as clinical research, where we're finding the therapeutic options. So I would actually not be able to tell you a lot about the finding. I know it's news that are coming out of my institution in terms of being able to grow the virus in the laboratory, which is aimed at finding vaccines and options.
Totally understood. And as I said at the beginning, it might not be your area, but thank you so much for the wonderful insights that you've just given. Hope to speak to you another time.
Thank you.
Professor Nombulelo Magula there from the University of KwaZulu-Natal.